Have you ever wondered why such a simple plant as the arrowroot has drawn so much attention in the treatment of cancer? This plant, which may be growing in your own backyard, holds surprising properties that modern medicine is beginning to discover. Today, I will reveal not only the proven benefits of arrowroot, but also how it can be an important ally in the fight against serious illnesses, especially for those over 60 years old. Get ready to uncover fascinating truths about this extraordinary plant. Arrowroot, a fascinating plant native to Madagascar, carries a rich history of medicinal use that spans generations. Its origin in rocky and arid terrains demonstrates impressive resilience, a characteristic that reflects its potential therapeutic properties. As a succulent with wide and vibrant leaves, arrowroot is not just a decorative plant, but a true botanical treasure with medicinal secrets that remain largely unexplored. Scientists and researchers have dedicated special attention to this extraordinary plant, investigating its unique properties. Early laboratory analyses reveal a surprising chemical profile, rich in bioactive compounds that pique the interest of the international scientific community. Its botanical characteristics are not mere coincidence, but the result of natural evolution that provides impressive defense and adaptation mechanisms. The cultivation of arrowroot has become increasingly accessible, allowing ordinary people to have this plant in their own gardens or pots. This accessibility has contributed to raising the interest of researchers and enthusiasts of natural medicine, who see in arrowroot a possible complementary alternative for various treatments. Preliminary research suggests that arrowroot possesses significant thrombolytic properties, capable of aiding the circulatory system. Its antioxidant compounds demonstrate potential to combat oxidative stress, which is fundamental in the process of cellular aging. Initial investigations also point to possible anxiolytic effects, offering interesting prospects in treating stress-related conditions. In the specific context of cancer, the studies are even more intriguing. Some laboratory experiments indicate that certain compounds in arrowroot may exhibit cytotoxic activity against cancer cells. However, it is crucial to emphasize that these findings are in the early stages of investigation, requiring further studies for definitive confirmation. The medical community remains cautious, recommending that arrowroot be viewed as a possible complement, never as a substitute for conventional treatments. An integrated approach that combines traditional medicine with natural alternatives represents the safest and most promising path in the pursuit of more effective and holistic treatments. The journey of understanding arrowroot is just beginning, promising to unveil fascinating secrets about how nature can offer us extraordinary therapeutic resources. Science continues its meticulous work to unravel the mysteries of this extraordinary plant. Medicinal properties of arrowroot. What science says. The scientific community has been paying special attention to studies that reveal the impressive medicinal properties of arrowroot. Unlike many plants with unfounded promises, this succulent presents characteristics that genuinely captivate researchers worldwide. Laboratory investigations have demonstrated that arrowroot has a complex chemical composition capable of positively influencing different systems of the human body. Its bioactive compounds act surprisingly on the circulatory system, suggesting thrombolytic properties that may help prevent vascular problems. The antioxidants present in arrowroot represent another fascinating element. These molecular components combat free radicals, responsible for premature cellular aging and various inflammatory processes. The ability to neutralize these unstable molecules constitutes a true strategy for organic protection. Researchers have also identified potential neuroprotective effects. Preliminary results indicate that some active principles of arrowroot can contribute to reducing anxiety levels, offering a natural mechanism for emotional regulation. This discovery gains special relevance in a context where stress has become a public health issue. In the field of immunology, studies suggest that arrowroot may stimulate the body's defense mechanisms. Its ability to modulate immune responses represents an extremely interesting factor for contemporary medicine, which seeks increasingly integrated and holistic approaches. The potential benefits of arrowroot do not stop there. Preliminary scientific analyses point to possible anti-inflammatory effects, capable of contributing to the balance of metabolic processes. This characteristic positions it as a promising component in strategies for prevention and therapeutic supplementation. However, it is essential to maintain a critical perspective. Although the results are encouraging, science requires methodological rigor. The current findings represent only the beginning of a research journey that promises to reveal much more about this extraordinary botanical specimen. The detailed analysis of arrowroot in the context of cancer reveals a fascinating and complex panorama. Scientists have meticulously investigated the molecular mechanisms of this extraordinary plant, seeking to understand its potential properties against cancer cells. Preliminary studies point to an intriguing cytotoxic mechanism. Certain compounds of arrowroot demonstrate the ability to interact with tumor cells, provoking a response that may limit their growth. This discovery, although still in the early stages, sheds a glimmer of hope in the realm of oncological research. However, it is vital to maintain balance and scientific caution. Current investigations represent only a glimpse of therapeutic possibilities. Researchers are emphatic in highlighting that laboratory results cannot be directly extrapolated to human treatments without rigorous clinical testing. The complexity of the molecular interactions between arrowroot compounds and cancer cells demands a multidisciplinary approach. Some studies suggest that certain active principles may induce apoptosis, a process of programmed cell death, in specific lines of tumor cells. It is crucial to emphasize that these discoveries should not be interpreted as a miracle solution. Conventional cancer treatments remain the primary medical strategy, and arrowroot should be regarded as a possible complementary ally, never as a substitute. The scientific community adopts a careful stance, recognizing the plant's potential but demanding robust evidence. Each new research study represents a cautious step toward understanding the mechanisms of action of this natural resource. The challenges are significant. Accurately identifying which specific compounds exhibit the highest therapeutic potential, understanding their mechanisms of action, and developing safe usage protocols are fundamental steps that demand investment and dedication from researchers. Patients and their families should always prioritize traditional medical follow-up, maintaining an open and honest dialogue with their healthcare professionals. Arrowroot represents a window of hope, but it should not be viewed as an isolated solution in the fight against cancer. The scientific journey continues, filled with mysteries and fascinating possibilities. Each discovery brings us a bit closer to understanding the natural mechanisms of healing and protection. An integrative approach is essential when discussing interactions between arrowroot and conventional treatments, especially in the oncological context. Healthcare professionals unanimously emphasize that any medicinal supplementation must be discussed and closely monitored. Cancer patients should understand that arrowroot does not replace, but may potentially complement traditional therapeutic strategies. Prior medical consultation is not just recommended, but absolutely necessary to assess possible drug interactions and individual risks. Experts warn that each organism responds differently to treatments. The uniqueness of the patient must always be considered, preventing dangerous generalizations. Some arrowroot compounds may interact with chemotherapy drugs, altering their absorption or effectiveness. Safety emerges as the utmost priority. Doctors advise that the introduction of any natural substance must be done with utmost caution, especially in cases of serious illnesses. Scientific protocols recommend periodic evaluations to monitor potential side effects or changes in the primary treatment. Experts highlight that modern medicine should not discard traditional treatments in favor of natural alternatives, but seek intelligent harmonization. Arrowroot can represent an ally, as long as it is used under rigorous professional supervision. Transparency and dialogue between patient and doctor becomes essential in this process. Sharing information about the use of medicinal plants, their dosages, and frequency allows professionals to make necessary adjustments to conventional treatment. Recent research indicates that some active principles of arrowroot may potentially modulate immune responses, offering interesting perspectives for complementary treatments. However, these findings still require more robust scientific validation. The integrated approach represents the future of medicine. Combining traditional knowledge with modern scientific advances allows for the development of more humane and effective therapeutic strategies, always prioritizing patient well-being. The journey of confronting cancer requires courage, information, and competent professional oversight. Arrowroot emerges as a promising possibility, but never as an isolated or miraculous solution. The role of arrowroot in alternative medicine practices reveals a fascinating chapter in the universe of natural health. Proponents of holistic treatments have shown an increasing interest in this extraordinary plant, envisioning therapeutic possibilities beyond traditional medicine. The quest for natural solutions has driven thousands of people to experiment with homemade recipes involving arrowroot. Teas, tinctures, and infusions are prepared with enthusiasm, carrying the hope of finding less invasive alternatives for various health issues. However, it is crucial to maintain critical discernment in this universe of possibilities. Not all information shared in alternative medicine groups is scientifically supported. Often, romantic narratives about medicinal plants mask the absence of rigorous proof of their effects. Practitioners of natural therapies argue that arrowroot represents more than just a simple medicinal resource. It would be a profound connection with ancestral healing knowledge. This perspective sees the plant not only as a therapeutic element, but as part of a holistic understanding of the health process. Phytotherapy groups and naturist communities have extensively shared their experiences with arrowroot. Personal accounts mix hope, faith, and expectations of healing, creating a powerful narrative that transcends the limits of traditional scientific validation. It is important to emphasize that such practices should not replace specialized medical follow-up. Alternative medicine can be a valuable complement, but should never substitute proven treatments and adequate professional oversight. Experts warn about the risks of generalizing benefits without solid evidence. The spread of information without scientific basis can lead people to abandon essential treatments, jeopardizing their health. True wisdom lies in balance. Integrating traditional knowledge with modern scientific advances represents the safest and most promising path. In this context, arrowroot emerges as an interesting element, but one that requires careful investigation and rigorous scientific approach. The journey of understanding medicinal plants is both fascinating and challenging. It requires curiosity, openness to new discoveries, and simultaneously, a critical and investigative stance that always prioritizes human well-being. The comparison of arrowroot with other medicinal plants reveals a fascinating universe of therapeutic possibilities. Unlike many natural resources, this plant stands out for the complexity of its bioactive compounds, which challenge traditional scientific understanding. When we analyze alternatives like graviola, another plant frequently mentioned in the oncological context, we identify significant differences. While graviola has studies suggesting anti-proliferative potential, it also presents considerable risks, especially during chemotherapy treatments. Arrowroot, on the other hand, demonstrates a more subtle and potentially less invasive interaction with biological systems. Plants like Pauperera and Uncaria, also investigated in the medicinal universe, share interesting characteristics with arrowroot. However, each species carries its molecular uniqueness, making it impossible to establish simplistic comparisons or hasty generalizations. True wisdom lies in understanding that no medicinal plant should be regarded as a universal panacea. Each natural resource has specific potentials and limitations, requiring rigorous scientific investigation and a multidisciplinary approach. Researchers warn that popular enthusiasm often outpaces proven reality. Reports of miraculous cures need to be analyzed with critical distance, prioritizing laboratory evidence and controlled studies. The international scientific community has dedicated increasing efforts to unravel the mysteries of medicinal plants. Arrowroot represents a particularly intriguing chapter in this journey of discoveries, provoking questions and awakening the curiosity of specialists. Doctors and researchers converge on one fundamental point: the necessity of an integrated approach. Natural resources can complement conventional treatments, but should never replace them. Modern medicine seeks to harmonize traditional knowledge with technological advances, creating more sophisticated and personalized therapeutic strategies. The diversity of medicinal plants represents a rich heritage of ancestral knowledge. In this context, arrowroot emerges as the protagonist of a fascinating scientific narrative, inviting us to rethink our paradigms about healing and health. The journey of understanding continues, filled with mysteries and surprising possibilities. Each discovery brings us closer to the complex web of interactions between natural resources and biological organisms. The final considerations regarding the use of arrowroot reveal a complex and fascinating narrative. This natural resource, so full of promises, demands a balanced and conscious approach. The potential benefits must be understood within a rigorous scientific context, without excessive romanticism or simplistic denial. The journey of understanding arrowroot demonstrates that nature remains an inexhaustible source of therapeutic possibilities. Its molecular properties challenge our traditional understanding, suggesting innovative pathways in the treatment of various health conditions. Patients and healthcare professionals must maintain a dialogical and open stance. Arrowroot does not represent an isolated solution, but a potential ally in the therapeutic universe. Its use requires specialized supervision, individual assessment, and constant monitoring. Current scientific evidence invites us to reflect deeply on the natural resources available. We cannot transform Arrowroot into a miraculous resource, nor dismiss it entirely. The wisdom lies in understanding its nuances and real possibilities. Medical professionals emphasize the importance of careful monitoring. Each organism responds uniquely to treatments, making personalized approaches essential. The transparent dialogue between the patient and the healthcare team emerges as a key strategy. Modern medicine increasingly seeks to integrate traditional knowledge with technological advances. Arrowroot symbolizes this journey of connection between ancestral knowledge and contemporary scientific investigation. Its trajectory represents more than just a medicinal resource. It serves as an invitation to a broader understanding of healing processes. Researchers continue to dedicate efforts to unravel the mysteries of this extraordinary plant. Each investigation represents a cautious yet crucial step in understanding its mechanisms of action and therapeutic potentials. Hope does not reside in unfounded promises, but in the systematic construction of knowledge. Arrowroot invites us to maintain scientific curiosity, respect for organic complexity, and openness to new discoveries that can transform our relationship with health. May this journey inspire us to view natural resources with reverence and the scientific rigor necessary to truly understand them. We have reached the crucial moment of synthesizing our journey of discoveries regarding Arrowroot. The plant that initially seemed simple has revealed a fascinating universe of therapeutic possibilities. Our invitation is for conscious reflection. Arrowroot is not a miracle, but it also cannot be dismissed. It represents a window of hope grounded in preliminary scientific research. Sharing this knowledge means empowering people with safe and critical information. We invite you to continue this relentless quest for understanding, always prioritizing health, scientific knowledge, and harmonious connection between traditional medicine and natural resources.